Well, thank you, Mr. Chairman. I thank you and your staff. I thank my leader, Ms. Rogers, and her staff as well. This amendment is based on H.R. 2929, a bill that I worked on with our colleague, Susie Lee. It expands upon the private sector efforts to provide access to peer support services, including virtual peer support, to help folks with similar lived experiences, including veterans and those who have experienced homelessness, connect with each other, and also offer support. We know that research and real-world evidence has shown that engaging with a trained mental health peer specialist in individual and group settings can offer needed support to maintain wellness, lead to better connectedness with mental health treatment, and assist individuals in crisis obtain needed care, which is so important. This program is similar to one that was authorized under the Support Act for individuals living with a substance use disorder. So the pandemic lockdowns demonstrated that access to mental health support and treatment is needed and can be delivered through virtual modalities. This amendment is going to help deliver much needed access to support and care that individuals across the country are lacking, particularly in rural communities. One outcome of the amendment will be to help connect rural veterans and others who may not have individuals geographically nearby to each other. So the amendment also provides a provision placing priority on supporting efforts to engage rural communities. Access to these peer support groups improve individuals' relationships with their healthcare provider. For sure, it reduces expensive inpatient service use. It reduces recurrent psychiatric hospitalizations for patients at risk with readmissions. It improves individuals' relationships with their healthcare provider. It better engages individuals in care and significantly increases individuals' abilities to manage their symptoms and reduce their reliance on formal services while still achieving positive recovery outcomes. I would note that this amendment is supported by a whole slew of mental health advocacy groups, including the Depression and Bipolar Support Alliance, the National Association of Peer Supporters, the National Council for Mental Well-Being, the National Alliance on Mental Illness, Mental Health America, the American Foundation for Suicide Prevention, the National Association of Behavioral Health, the National Association of County Behavioral Health and Development Disability Directors, and the National Association for Rural Mental Health. Thank you for the opportunity to offer this amendment. I'd like to think that I know that it has strong bipartisan support. It ought to be included as part of this. Those of us that return virtually every week to our districts know the need for this as we sit down with many of our veterans who deserve this service. For all of us, I know veterans' votes are often the easiest ones that we ever cast. This ought to be an easy one too. And with that, Mr. Chairman, I yield back the balance of my time.